Hello, my name is Laura Lee Reiber, and I'm a nurse on a progressive care unit here in Bellingham, Washington, and I've been a nurse for 8 years. This is my personal philosophy on healthcare and nursing. As I did the reading for this module, there was a couple of terms that really resonated with me, and I felt really described how I strive to practice and how I hope to practice in the future. And the first of these terms is autonomy, and that's supporting patients in independent decisions, especially regarding their healthcare goals. And I think can be a tough one for some healthcare practitioners because we feel that we know more than the patients about pathophysiology, pharmacology, the disease process. So I think it's hard for us to sometimes not feel that our answer to the problem is the only answer to the problem. But I think it's important also to recognize that sometimes patients have different goals and different things are important to them than the ones that we think would be important. So, for example, I had a patient that was admitted several times for heart failure exacerbation. And he told me before dinner time that he would not take any of his medications, including his carvedilol, unless he got a cheeseburger for dinner. And of course, he was on a low sodium diet, and cheeseburgers weren't an option on that diet. So I called the doctor and I discussed with her that maybe we should order him a cheeseburger because he was going to eat cheeseburgers at home, and wouldn't it be a good idea for his medications to be titrated to the food that he would actually be eating? She agreed. We got him the cheeseburger, and he was happy, and he took his medications. I did have the discussion with him about diet, but he already understood, and he was just not interested in following a low sodium diet. For him, he would rather live shorter and be admitted to the hospital more, but life just wasn't worth living if he had to have what he described as tasteless food. And, I think even though it can be sometimes a little frustrating when it seems like patients are picking the wrong answer, it's important to recognize that this is their life and, these are the things that they find important. Another term that I think is really important is justice, and that's the fair distribution of resources. And I think it's just important to remember that not everybody can afford health care, not everybody has insurance, and especially not everybody can afford their medications. I had a lovely young patient who was admitted, and on his chart it said that he was non-compliant with his meds, and he hadn't been taking any insulin for diabetes, but he couldn't afford it, and he couldn't afford the doctor's visit so that he could get the prescriptions written. So he came in and he'd had a big heart attack, and he was wanting to leave as soon as he could get up and walk, even though it wasn't really safe for him to go home. And you could just see the anxiety radiating off of him about how much this was going to cost, and it was just a huge, huge stressor. And, I think, especially in the office, if we talk to patients about these are the medications to treat your condition, and maybe do you think you'll be able to afford these medications? Because patients aren't going to necessarily volunteer the information that they can't afford the medications, because that might be seen as embarrassing. But if you can connect patients to resources so that they can treat their conditions, before it becomes a big event like a heart attack, we're going to save them money and stress, and it's just going to be a much better health outcome for them and their families. And the third term that I think is really important is non-maleficence, and that's to do no harm. And I think on our floor we've just started implanting left ventricular assist devices, or LVADs, and these are for patients with really advanced heart failure, and they just can't function they just really can't function. They're pretty near to death. And so this, in a sense, you can see the benefits of this. These can be somewhat younger patients, and the heart failure is a thing that's taking them out. But we also, when they recover, it's a really tough surgery, and then they have a lot of problems that will be with them for the rest of their lives. You know, they have particularly GI bleeds, and it's interesting to see, to think about, is your life better or not? And I understand that's definitely a decision for the patient to make. But I think it's very, very important that they have all the right information about what is recovery going to look like and what are the complications, because I definitely think that our surgeons are so excited to offer the technology that sometimes they don't accurately depict what recovery will be like. And when you're at the bedside with these patients and they just look like they're being tortured, that's a really difficult place to be. And I think that's a good conversation to start also if you're in the office, and talk to patients about, what do you want out of life? How far are you willing to go to get that? You know, what are you willing to compromise? But anyways, this has been a really interesting class so far. I'm looking forward to learning more and improving the way that I practice. Thanks.